One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
Showtime. One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
Showtime. One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One, two, two, three.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One, two, one, two.
E is all that remains of a once powerful note. Right now, you're on the threshold of an amazing adventure.
One,
Hello, Bear. Needle here.
Nice to see you today, Needle. Nice to see you too. I'm pleased to see you.
Happy Thursday, everybody. The stream went down this time when I was just waiting for the fucking 3-minute ad to finish playing. So I had to wait another 3 minutes for anybody who got fucking cut off. and had to watch the ad again. You look more 2D than the last time. I don't know what of which you speak. I looked normal last time, and I looked normal this time. I don't like being covered by the chat. I'm gonna move over this way. So, I hope everybody is having a good. Am I being cut off at the bottom there? Just very slightly. I can't stand it. There we go. I don't want to break your immersion. You know, I don't want you to get the idea that the PNG on your screen isn't a real girl. You know. Topaz Wings, thank you for the follow. The follow worked. There's no sound. Is that my followers are being my alerts are being so weird? I'm glad I finally caught you live. Me too. Well, hello, welcome. I'm so glad you could be here. Look, this is for you. So let's see. What do we have in store today? Well, if you were at the tail end of the last stream, you heard me say this. I came across this very interesting little program called Full Code Medical Simulation. Holy shit, Mika! Thank you for the sub gifted to Topaz. What the fuck, thank you. What is that? Fuck, is it so nice of you? Thank you, what the fuck. Now let me see if I can find exactly what made me want to play this game. Kindness blooms. Love can bloom on the battlefield. I always believed. So this is a legitimate medical simulation. But it gives you something called a CME credit. I don't know what that is, but it sounds good. Punish Buster, how's it going? It's going good. How's it going with you, motherfucker? I'm looking for something. Give me a minute. Here we go. Here it is. I'm raging at a smart light bulb that doesn't want to work. Keep raging at it. They react when they're scared. You need to put the fear of God into it. It has an AI thing built in, where you can ask your patient questions. And I saw this. Do you feel any better? Yeah, I feel a bit better now. The medicine helps the pain and nausea. Do you have any other questions for me? You forgot the rules.
Number 1 victory royale.
Hang on, hang on. There's also a second part. I'm gonna... There we go. It's really just more of the same, but I think it is imperative that you get both parts. So, I just saw this and I thought, wow, that's exploitable. So that's what we're doing today. We're probably gonna do something else after it. Me in the nursing home. Abusing the AI sounds like a fun pastime. It is! I do it frequently on this stream. I'm really good at fucking with the robot because, I speak very precisely. And I'm very wordy, so the robot sees me using all those words, and it doesn't really understand how to parse them logically, so it's just like, okay, I'll agree with whatever this dumb fuck is saying. But, you know, we have to do this properly. We can't half-ass it. Let me go into my dressing room real quick. The doctor is fucking in, bitches. Needle MD, exactly. Now, I did mess with this a little bit, and what I learned is that this game doesn't fuck around. Doc, my head hurts. Can I have some pills? Yeah, just go into fucking pharmacy and get whatever. It's fine. Tell him I said it's okay. How'd you get that to fit your big brain? The strap's made of elastic. I got it special ordered. I did mess with this a little bit. And what I discovered about it is that it's very, realistic. And you'll see what I mean by that shortly. Now, this actual thing is like $72 a month. And I don't have $72 a month to spend on, a game I'm gonna play for like maybe 90 minutes. So we're just, you know, we're gonna make do with the free cases. It's fine. And more specifically than that, we're gonna make use of the free cases that have the patient AI. That's what we're in for. Now, because the guy before... Whoops. Go away, Puffy. I'm not ready for you yet. Because number one Victory Royale, Dr. Fortnite, already took care of the lower abdominal pain and vomiting guy. We're gonna go with, word-finding difficulty. 68-year-old man presents with difficulty finding words, trouble writing, and unsteady gait. Case details. Yeah, those are the case... Oh, here we go. CME eligible. I don't know what that is, but I'm gonna get it. It's gonna be awesome, and I'm gonna get into the college with it. And I'm gonna be so good at it, they're gonna just forego my loans. Sounds like he's in love. It's classic. Many such cases. Let's see. Patient is a walk-in. 68-year-old man with word-finding difficulty for 3 weeks. 3 weeks? That's kind of a long time to let this happen. Smile symmetric, grip strength normal, BP 165/70. I think that's high? No stroke alert activation, direct to treatment room. Really? He lucky. He didn't have to fucking sit and wait for a couple hours. Hello, Grandpa. Get this guy a thesaurus. Now let's see. I don't think we're gonna get anywhere just by fucking looking at people dogs out. Put your grippers away. No shoes, no shirt, no service in the hospital, old man. Oh my god. I didn't fuck, the one I messed with didn't have the patient AI. It just had a big list of tests you could perform. I've never gotten a chance to talk with the guy. But then again, if he's having trouble finding words, you know. There we go. That's too loud. We don't need the hospital ambiance. It's just gonna make us all uncomfortable. How is the audio, by the way? Does the background music need to go up, down? I could just see in the fucking OBS things that the hospital ambiance was too much. Let's see. Thanks for seeing me today. Game up a bit? Well, that background music isn't the game, it's me. So it's fine if I do this? I mean, the only sound in the game is the hospital ambiance. Which just consists of, like, you know, talking in the background and the occasional clatter of a cart or whatever. Let's see. Thanks for waiting while I got this sorted out, Grandpa. What seems to be the issue, Gramps? I've been having trouble finding the right words, and I feel really tired, too. Seems like you found the right words there. Yeah, but it's been hard. I sometimes say the wrong thing or write down the wrong number. Have you been smoking too much weed? Weed? I stopped smoking a while ago, just trying to take care of my health. Have you tried? He has a few days at best. That's what I'm thinking, but we can't tell him that right now. It'll scare him. Have you tried taking smoking back up? That may help. Nah, I don't think that's the answer. I'm more worried about these word problems. I'm not here to fucking help you with your math homework, Grandpa. If you got word problems, you gotta do them. You gotta put them into Chat GPT if you want help with them. That's not my, Oh, son of a bitch!
Room 1. Post-stroke, room 1.
Fuck! God damn it. What? Grandpa? What are you... What are you doing? Just trying to figure out what's going on with me. Well, he sure is articulate for a seizure. He needs to be put out of his misery. No, I just got a fucking email. I forgot to fucking cancel my GeoGuessr subscription before it reset. Now they have another fucking $5 from me. Fine. Enjoy the $5, GeoGuessr. Well, let's do this again. It said something about... I don't think we're gonna get anywhere by talking to him. He seems stupid, but it said do something with his brain. Oh, here we go. Yeah, look at all this shit. Perform neurological exam. There we go. Awake and alert. Mild dysmetria is present on the right. What is dysmetria? Is it like shaking? Drooping? I don't know. Unsteady gait. Frequent word finding difficulty and word substitutions. No dysarthria. I don't know what that is either. Normal motor and sensory function.
Code blue, hospital lobby.
Well, it said do something with his brain. Let's do a CT and his CT scan on his brain. Yeah, that looks to be a brain. He's got a big hole in it right here. So we're gonna need to fill that up with some rubber cement. But other than that, it looks fine to me. There's a probable left parietal mass with surrounding vasogenic edema.
Dr. Febowitz, please report stat to room 10. Febowitz to room 10.
Well, okay. We need vascular access first. Insert IV. Attach monitor. There we go. There we go. I'll give you some saline. Saline's always good, because then we can charge you for it.
Code stroke, room 1. Code stroke.
Well, I'm not sure what we do about his brain. I mean, do we just take him into surgery now? I'm not a surgeon. I'm a doctor. Oh, prep for operating room. There we go. Let's see. What others thing? Let's do a blood culture. Let's see what's in his blood. Blood culture up and sent to the microbiology lab. Okay, when do we get those back?
Code STEMI, cath lab activation. Code STEMI, cath lab
And how about a urine culture as well? Urine culture results are in. Okay, what are the results? Be real with me. You've been getting some strange gramps. How do I access your results? It says urine culture in progress. But it should be done. In process even. In process.
Dr. Febowitz to room 10.
Urine. Lab work. Here we go. Urinalysis. Oh, here we go. Urinalysis. There we go. Here we go. This is it. Urine culture is different from a urinalysis. Okay, I'm learning. Color is yellow. Clarity is clear. He doesn't have any glucose or ketones or nitrates or leukocytes. So he doesn't have diabetes.
Code blue, hospital lobby.
Let's do a blood test. Normal. Well, your blood's fine. Can I perform like some cognitive exam? Oh, psychological exam. Here we go. Anxious, depressed affect, denies suicidality. 96 milligrams is way too high. Use a doctor here. Me or you? Let's check your neck.
Prevalent cervical fat balloon cancer.
There is cervical paraspinal muscle tenderness without midline tenderness. No meningismus. Well, he doesn't have any meningismus, so that's good. It's good to not have any meningus. Let's check your abdomen. Soft, non-tender, normal back bowel sounds. Check his genitals. That's— oh my god, there is! Check his pee-pee. Normal penis and testicles, no masses, no hernias. Good! Very nice. Very nice, Grandpa.
Code blue, hospital lobby. Code blue, hospital lobby.
I love when there's no masses. Hey, bro, can you check my balls for cancer? I want to make sure I don't have a lump. Can you I think you missed a spot. Can you do it again, bro? I think you missed a spot. Can you do it again, bro? Bro, I think you missed a spot. Can you— he said his problem was like he's having trouble kind of coming up with words. Word finding difficulty. How long has this been happening, Grandpa? It's about 3 weeks now since I first noticed the word finding trouble. Give me an example of the word finding trouble. Check him for lice. He itched his head. He's bald. That's a false lead. He just has eczema. Sometimes I try to say a word and it doesn't come out right. Like the other day I meant to say apple but instead said orange. It's frustrating. Well, do you know the difference between apple and orange? Yeah, I know the difference. It's just that my brain gets all mixed up. Well, don't get fucking defensive about it. Pasquiliano. Sorry, Pasquilino. I thought when somebody said Pasquilino in chat, they were making fun of you. I didn't realize that was your real name. Procedures. That was a very horrible thing to say to somebody. Whatever, who cares? He's not gonna remember, his brain's all fucked up. Oh, there we go. He needs a uterine hemorrhage medication. I think that's gonna make him all better. Lumbar puncture. Fuck, we do need to lumbar puncture him, cause it's in his nerve, it's in his brain. We need to check his spinal fluid. Alright, buddy. Fucking bike down on this leather strap. It's gonna hurt like a motherfucker. Please order the test you want and I will send it to the lab. Okay. Do the lumbar puncture test. I'm not sure.
Code dummy, cath lab activation. Code dummy, cath lab activation.
There we go. Completed the MRI, lumbar spine. Okay. Well, how do I want to send your fluid to the lab. Lab. Fluid. How do I send your fluid to the lab? Hey, that one worked. Moody Orange, thank you for the sub.
I can't tell if this means anything.
It always means something. Don't let anyone fool you into thinking that this world isn't full of hidden meanings just for you. Where do I send his fucking fluid? I can't do it again. Blood type and screen. Complete blood count. So your white blood cells are a little bit high. Your hematomatoes are good. Your hemoglobin is good. And your platelets are also good. Platelets. What a fun word, platelets. Hemogoblins. That's your problem, you got goblins in there. Who put the goblins in your blood, Grandpa? Were you taking the goblin pills again? Liver pro BNP? Heart failure. That doesn't help me. Tropopin, muscle breakdown of the heart. Platelets are the little plates that the red blood cells eat oxygen off of. Have you checked his humors yet? Oh shit, that's a good idea. Humors! Black bile! Come on! Work with me here! Okay. Pro BNP. That's cardiac. Phosphate levels. I don't think that's the problem. Magnesium. His kidneys are fine, I think. Liver. Pancreatitis. Lactate. Milk his tits. We got 1.8 mmol of milk. I don't know what mmol is. It's a little bit high though for this guy. Brain transplant. Transplanat. Well, where is free calcium in the blood? Calcium ions, D-dimer. None of these help me. Other labs. No definition provided for C-reactive protein. Great. Acetaminophen. Amylase, creatine. CSF cell count. Oh, here we go. He has long COVID. Oh, fuck, he might. But that won't show up on a COVID test. What are we supposed to do about the hole in his brain? I don't know. We're trying to figure it out. What if he had a low taper fade? Low taper fade. So he has heart nucleated cells. This doesn't explain to me what that means, which is good. Gram stain. Oh, organisms. We need to check him for organisms. He's got no organisms. Who knew medicine wouldn't be fun like video games? Who's not having fun? What did his brain say? His brain didn't say anything. This is all we have from his brain. We took a CT scan of his head and he's got a big fucking hole in it. No, it was something about there was a probable mass as a there was a probable left parietal mass with surrounding vasogenic edema. Which is helpful information if we knew what to do about that. But let's check his spinal fluid again. Serum ratio 0.6. He's not seizing again. I think he did it last time to avoid the conversation. I think you're right. I think this fucker's malingering. Have you looked in the other tabs? Yeah, there's a lot in these tabs. There's quite a bit. Let's contact neurology.
Coach Denny, Catholic
Oh my god, we're getting somewhere! These findings are concerning for a brain mass. Either a primary brain tumor or a metastatic lesion. Oh god! I recommend consulting initially with neurosurgery. Got it! The imaging is concerning for a possible mass in the parietal lobe. Since there is surrounding vasogenic edema, I would recommend administering dexamethasone. Please admit the patient to my service for further evaluation. Please obtain an MRI with and without contrast. Okay, we're getting somewhere. Dexamethasone.
stroke, room 1. Coach stroke,
Dexamethasone. Take this dexamethasone. Being a doctor is easy. You just ask the other people around you. And what does he need? Like an MRI. I can't give him another MRI. He already has one. Oh no, here we go. Well, yeah, that doesn't look great, does it?
hospital for holding on expenses 500.
He's pregnant! Oh no, he's boy preggers! Contact OBGYN. Fuck, I literally can't. That's fucked up. What if I get a patient who's like pregnant and doesn't know it? Like that TV show.
Dr. Pebblewitz, please report stat.
Well, I got your MRI.
Dr. Pebblewitz to room 10.
Well, let's admit him. Yeah, there we go. Discharge was neuro. Well, let's break him the bad news. Let's break him the bad news first. Grandpa, I have your test results. Grandpa, I hate to say this.
Dr. Pebblewitz, please report stat to room 10.
What is it? Just tell me. I'm listening. Grandpa, you have Terminal 7. I don't know what that means. Can you explain it to me? The doctors don't know what it means yet. But it's bad. That sounds really worrying.
Dr. Pebblewitz, please report
Yeah, it's not great, is it, Grandpa? What do you think I should do? I think you should fake another seizure for the Valium. That's what I would do in your situation. I don't know about faking anything. That doesn't seem right to me, fucker. You're just playing dumb because I called you out on your bullshit before.
Coach Denny, Catholic activation.
Anyway, you have cancer and you are going to, what is the cancer doctor, on Ecology Land. It's like Disneyland, but for cancer. What does going to Oncology Land mean? Do you actually treat old people this way? Yes. I go into the nursing home every day. And I have this conversation with them. I tell them they got diseases that don't exist. They fall for it every time. Old people are so fucking stupid. Well, do you know Disneyland? Yeah, I know Disneyland. It's a fun place. What does that have to do with my health? Oncology Land is like Disneyland. Except you go to the hospital and get chemotherapy. It costs about the same, though. That sounds pretty rough, but if it helps me feel better, I guess I'll go. I think that's the right choice, Gramps. Alright, what is your final diagnosis? Select at least one diagnosis from the differential lab. Cancer. Terminal 7. Tumor. 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 Tumor lysis syndrome. Well, no, not quite. Pseudotumor cerebri, also called idiopathic intracranial hypertension, is a condition in which elevated CFS pressure causes headache and visual symptoms. It is most commonly seen in overweight female patients of childbearing age. That's really specific. Well, let's see. Here we go, brain mass. You got a brain mass? And you're also ugly. Where is that diagnosis? Where is ugly? It's probably in dermatological. Staph scalded skin syndrome. Close enough. Anyway. Discharge was neurosurgery referral of a diagnosis of brain mass. Are you sure? You know I am. Yeah! Oh, what? It wasn't a brain mass. Then what the... But he had a big fucking mass in his brain! How can you tell me it's not a brain mass? That's what was on the fucking CT scan. You were some... It wasn't an option to admit to neurosurgery. I only had one option, and it was fucking discharge. What do you fuck? I got 100% for communications, though. He loved it when I talked to him. He loved the oncology Disneyland metaphor. Uh-oh. You are viewing an unlocked result. 1 unlock credits left. Uh-oh. You know what that means. That means we got a time limit on this shit. We can't just fuck around with Mr. Magoo all day. Dr. Shitcoin. Well, this is an actual piece of fucking, like, medical, training technology. It's like $300 a year to unlock the full thing. And I'm not, I don't have that fucking money. I mean, I guess I could probably just open this up in an incognito tab. I can usually get around it by doing that. Is this even gonna happen? Oh no, it does happen, okay. Help us improve full code. I loved it. He loved the oncology Disneyland metaphor. So realistic. Let's do it again. Let's do it again. Sometimes I think AI is just advanced DRM protection. Okay, now let's see. Let's do this properly. He needs a lumbar puncture, first of all. Where the where is it? Let me do the lumbar puncture. Why did it take away my ability to fucking puncture his lumbar? I can only do the MRI now. The MRI doesn't help me. He doesn't have anything in his spine. He's got shit in his brain.
Room 1.
It's shaped like a walnut. Did you put a walnut in your brain again, Grandpa? I thought we told you to stop putting walnuts up in there. You're allergic.
Dr. Febowitz, please report stat.
Seriously, what the fuck did I do to like puncture to do his lumbar puncture last time? Peripheral smear. Is that like a is that like a pap smear? Can I go mess with his pussy? Might be in another tab. Here we go. You're right. There we go. But that's not an intervention. So that's investigating. Okay, CSF is cerebrospinal fluid. There we go. This looks the same as the last guy. They're twins. Say let the students work on the clones. Man, that would be fucked up. I can see a world in which that happens, though. Like just repeatedly cloning terminally ill people just for the sake of teaching medical students. I could see that. I think this world is horrible enough for that to happen.
Hospital lobby. Code blue. Hospital lobby.
Forget all. Shit! Oh, God damn it! Intervene. Meds, lorazepam. Vascular access. Shit! Okay, well, okay. We're learning more. We're learning more every time. Get done. And what we learned this time is that the first thing we do is we put the fucking IV in. There we go. There we go. And now we do the lumbar puncture. And now, and now we do
Hospital is holding on extension 3500. Dr.
the
Hospital is
fucking
holding on extension 3500.
cell count. Just do all of them. Just do as many tests to his, we haven't even asked his symptoms. We know his symptoms from the last time! We remember them from the old timeline. We're like Homura. We don't need the formalities. We just gotta keep going. Has it not changed? Nope!
Holding on extension 3500. Dr. Bakio, hospital is holding on extension 3500.
Okay, so now he needs the MRI. And now we're gonna communicate with neurology. We're also gonna communicate with neurosurgery. And now he needs the dexamethasone. Now he needs his dexamethasone. There we go. Admit to neurosurgery, not discharge with neurosurgery referral. You were right.
Room 1. Code stroke, room 1.
And now he's got a brain mass. Diagnosis, brain mass. Grandpa, I am from a previous world line where you died. Wasn't brain mass wrong though? But he has a mass in his brain!
Hospital is holding on extension
How is it not brain mass? He has a big mass in there! We looked at the walnut! I am going to save you in this reality.
That sounds kinda strange. I'm just trying to figure out for me what's going on with me right now, you know?
Oh, here's oncology. Let's see. Tumor lysis, thrombotic purpura, sickle cell crisis,
Dr. Bakio,
blast crisis.
extension 3500.
Great.
Alright, Grandpa. What specific type? They want me to get real specific with the cancer. Lymphoma? I don't know the cerebral edema test. I don't know the edema test. I don't have the edema machine. It reads a neurosurgeon's message. High-grade glioma. Oh my God. Glioma. Where is it? Listen, it says the imaging is concerning for a mass in the parietal lobe. It's a mass and it's in his parietal lobe. It's a brain mass. It's what it is. It's not wrong. It's brain mass. It's fucking not here. Vasovagal syndrome. That's just fainting.
Dr. Febowitz, please report stat to room 10. Dr. Febowitz,
Do you have any
to room
questions
10.
about my symptoms? I already know your symptoms from the last time. You are having trouble finding words. Do you have any idea what might be causing it? No. It is a medical mystery. And the doctor recommends euthanasia. I don't think I'm ready to talk about that. I already know your no symptoms. Is there anything else you'd like to know? When was the last time you got your dick wet? It might be syphilis.
I'm not sure that's the problem.
Who is the doctor? You or me? Then I think it's syphilis. So answer me. Are you engaging in coitus? Neil, you type really fast. What's your speed? Don't know. Never checked. No, I'm not really doing that. I've just been feeling off and focused on my other symptoms, lady. Have you tried hooking up with a prostitute? Nah, I haven't done that. Well, you're very casual about it, Grandpa. But I think we're done here. There we go. Get out of town, Grandpa. See, score details locked. Use an unlock credit. Yes.
How is it not a fucking brain mass?
Man. He literally said, yeah, I got a lower score than last time. To be fair, he didn't seize last time. He, he pretty much dies automatically when he seizes unless you, administer the, medicine within, like, 20 seconds. I'm great at, communicating, though. MRI, head and neck, neutral. What do you mean, neutral? How was I supposed to figure out he had a fucking mass in his brain? Let me try something. I don't have any more of those fucking unlock credits. But maybe if I do this. You could have listened to the vibrations from his skull, like that fucking dinosaur in Vitsy. Remember the dinosaur in Vitsy was the fucking thing on his hair that went Remember Vitsy? Vitsy knows lots of things. And she lives right in your own TV. But you must pay her $20 to get out. Do you think Vitsy could be a doctor, or would she peddle holistic healing to the patient? You know what? Vitsy is fucking invested in science, so I have a lot more faith in her than fucking Minnie Monkey. Minnie Monkey... You know, Minnie Monkey was talking about how much apple cider vinegar will cure your zits and your burns and shit. So at least Vitsy believes in science. At least Vitsy isn't a fucking anti-vax weirdo. I wonder if that actress still thinks about her Vitsy days. Nah. Oh, that's blocked out of her memory. And if someone says the word Vitsy to her, her fucking eyes just glaze over. And she goes into a fugue state until they stop talking about Vitsy. It's a coping mechanism. I'm glad you're normal, Needle. Me too. Can you imagine how much more difficult this world would be if I wasn't normal? Imagine. Okay, let's do this again. Son of a bitch. Welcome to full call. You know what? Yeah, give me the instruction. Give me the walkthrough, buddy. Let's do it.
Let's get started. The patient is in the ED due to word-finding difficulty, mild headache, and general fatigue, which are concerning for a neurological issue. Initial key considerations include a thorough neurological assessment and potential imaging like a CT or MRI to evaluate causes like a mass or other neurological conditions. Well, that's you know what I learned last time? That the fucking CT and MRI is neutral. I got a neutral score for that. I didn't say good job for doing the fucking MRI. I got neutral, which means you're fucking lying to me. What? Open up the patient tab. Talk to the patient. Thanks for seeing me today. Okay. Do you have more questions for me? No. Is there anything else you'd like to know? No. I hope you have an idea about my symptoms. I don't.
How are we supposed to decide whether the overview is helpful or not until he's been diagnosed fully?
Code stroke, room 1. Code stroke, room 1.
That's a good question. It's a good question, actually. Do you have any thoughts on what's causing my symptoms? No. Okay, I guess I'm just feeling a bit lost with all this. Me too. Yeah, it's really tough. I just want to understand what's happening. Me too. Inquire about, okay. Have you had a fever? Have you been experiencing night sweats? I haven't really noticed any night sweats. Fuck, what was the other thing she said? He is a sussy little baka who needs to vent and then ventilate him. I can't. If I put the fucking ventilator, if I put him on the ventilator, I can't talk to him. And that's half the fun. That's half the fun.
Code stroke, room 1. Code stroke, room 1.
Headache, sensory changes, coordination issues. Have you had a headache? headache, but he got it. They usually go away with ibuprofen. Heat chatch. How is your coordination? I feel a bit unsteady when I'm walking sometimes. Being a doctor is supposed to be fun. It's supposed to be draining and expensive. Your baby voice makes my youngest cat attack me. She hates it. You're the one who keeps redeeming it. Are you fucking torturing your cat? What the hell? Or are you torturing yourself? Like, I don't... let's see. Let's do his... Yeah, okay. Fucking... What? What do you mean lumbar puncture harmful? I mean, yeah, it's gonna be harmful. It fucking hurts when you put a big needle in your spine. Don't put me in there, by the way. It's dark. It can fuck up your spine for life, really? So then why do they do it? Okay, talk to him. What sort of information do I need to collect from him? I think I've got to get him in chemo. Shit! 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 Go! 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 Get him! Get him! Get him! Get him in! Come on! Come on! That's That's what you do when the fucking patient seizes. You give him benzodiazepines. That's what the fuck. I know that. I know that much. Is it the ketamine? I'll walk you through the case. Okay, let's do this again. CT or MRI, and then neurological assessment. Got it. First, open the patient tab. Got it. I know what I'm doing. I know what the fuck I'm doing, kind of. Now let's see. Now we put the fucking IV in. Have you experienced headache? Have you experienced fever? Have you experienced problem walking? Have you experienced night sweat? Have you experienced... What have you experienced? Cognitive difficulty. Elaborate on that.
Room 1.
When I'm writing a check, I'll write an 8 instead of a 2. Sounds like you need to go back to kindergarten, buddy. Fuck, I want to go on a tangent, but if I leave him alone, he's gonna seize again. Have you had sensory changes. I don't know what you mean by that. What did you eat for din-dins yesterday?
Code dummy, cath lab activation.
I had some chicken and vegetables. Sounds yummer. Yeah, it was alright. Just trying to keep things easy. Fuck yeah, dude. Are you feeling seizure-y currently? No, I don't feel seizure-y. Well, that's good. If you did have a seizure, I would be very upset. Can we look at his pupils? That'd be a good idea.
Dr. Febowitz, please report stat to room 10. Dr. Febowitz.
Head, ears, neck. Okay. Normal conjugate gaze, normal extraocular movements. Okay, that's good. Perform psychological exam. Perform neurological exam. Ah! Critical! Critical! Did you see that? Critical! Do you know what dysmetria is? Neither do I, but you don't have to worry about it, I don't think. Let's see. Which can help narrow down further causes and guide neurological. Okay, I get it. I talked to him. Is that the only fucking suggestion you have for me? What is this shit? I never checked. Commonly used Lactatin corticosteroid was range of indications. Can treat respiratory infections, asthma, COVID-19, cerebral edema, and other things. Sounds like it just fucking cures everything, huh? Hint at critical action. Yes. Inquire about general symptoms like fever, night sweats, or weight changes. Okay. I've asked about everything else but weight loss. Have you lost weight recently? No, I haven't lost any weight recently. Okay.
Dr. Bhatia, hospitalist is holding on extension 3500.
I did!
Dr. Bhatia, hospitalist
Man.
is holding on extension 3500.
Review of symptoms. Neck exam. How's your neck, buddy? Yeah, he's got, it's like a little bit tender. I remember that from last time. The problem is there's no win condition. You just kind of have to do all the things you need to do before sending them through. Be more specific.
Code STEMI, cath lab activation.
Be sure to ask about constitutional body symptom problems. Does he have insurance? Describe your physical symptoms. Ed, what's up? We're diagnosing this old man. Do you have
Code STEMI, cath lab
health
activation.
insurance?
Code STEMI, cath lab activation.
Good. I'm done. See, it has a big check mark by it. We're getting there.
Dr. Bhatia, hospitalist is holding on extension 3500.
Neurological assessment.
Dr. Bhatia, hospitalist
What's
is holding on
dysmetria?
extension 3500.
Inability to control the range of movement. That's okay. Musculoskeletal. Abdominal. Let's just do all of them. How are you doing, buddy? Let's just do all of them. Skin exam. Warm and dry. You love to see it.
Code stroke, room 1. Code stroke, room
Where's my
1.
check mark for this one? I did all the tests. Where's my good job check mark? I did fondle his balls. They're normal. He's got no masses or hernias. Let's put the monitor on you. There we go. There we go. And let's give him
Dr. Bhatia,
some
hospitalist is holding
saline.
on extension 3500. Dr. Bhatia, hospitalist is holding on extension 3500.
Just get into position for intubation. We're not gonna do it. Just lie down.
Code 7,
Oh, you like my reflecto thingy? Thank you.
satellite activation.
Why don't doctors wear the reflecto thingy anymore? I think it has a use. Okay, get up. No, I don't want. No, get up. I don't want you to lie down anymore. Get up. Well, I guess we have to intubate you. No, I'm not gonna fuck with him.
Hospital lobby. Code blue, hospital lobby.
Because we're doing too good this time to fuck with him. What else should I do? Already did it. Investigation plan. Perform a CT of the head. Done.
Dr. Bhatia,
Okay,
hospitalist is holding
did
on
that.
extension 3500. Dr. Bhatia, hospitalist is holding on extension 3500.
Okay, now we're getting somewhere. In this case, the patient presents with subacute neurological symptoms. The differential diagnosis should include brain mass. Other possibilities include ischemic stroke, which could lead to sudden cognitive changes to subarachnoid hemorrhage. He's got spiders in his head! Not quite spiders, just subarachnoids. Oh, below spiders. Well, I've done all this shit. I did his CT. Let's just do a basic blood panel. There we go. Recommended. See? Can I do an ultrasound on his brain? Ultrasound his ruck. Where is the ruck located? Liver and gallbladder. Oh, okay. Ultrasound fast! Where's fucking neurological? What about stroke? Here we go. Good choice. Brain mass. Good choice. Hemorrhage. Subarachnoid hemorrhage!
Dr. Bhatia, hospital is holding on extension 3500. Dr. Bhatia, hospital is holding on...
I don't know how you check for the brain bleeds, though, aside from a fucking CT scan, which we already did. Like this, we can't do an ultrasound on his head. Complete blood count. There we go. That's something. Hemoglobin is good. You telling me a hemoglob this?
Code 7, cath lab activation.
Coagulation panel, no. I don't know what the fuck else we think we need to do to him. I think he's good. Like, I think we got him. Admit this guy to neurosurgery. But my final diagnosis... I don't think it's a stroke, because he's not like, you know... A stroke, you know, you lose control of one side of your body. He's fine with that. He's just being like kind of weird. I'm going subarachnoid hemorrhage. It's spiders in the brain. Final answer.
Dr. Featherweight, balloon 10.
Damn it! Oh no! Holy shit! Look though! Look! I got 100s across the board. I just fucked up because I didn't diagnose him with the stroke he had. Which is fine. What were the other options? It was like stroke, I think. It was like stroke, subarachnoid hemorrhage, and brain mass. Those were the things they were insinuating at. Did you check his belly button? Damn it! I always forget about the fucking belly button. Now let's check out this detailed discussion. We're done with this. We're done with this. So let's check out the detailed discussion. Your patient presents with a subacute and non-specific neurological complaint and is found to have a new brain mass consistent with likely high-grade glioma, high malignant primary brain tumor. Brain mass, huh? Yeah, it was yeah. So it is brain mass, just like I thought. Just like I assumed, because of the CT scan, with the fucking mass in his brain on it. Lumbar puncture is typically not of diagnostic value and may be dangerous in the presence of space-occupying lesion. Whoops. A biopsy? How the hell am I supposed to do a fucking... Where is the biopsy option? Was that ever an option for me? Biopsy. No. Biopsy. It fucking, the thing says, dude, you have to do a biopsy to figure out what it is. But I got no biopsy option. Yeah, it's fucking... It seems to be leading me to do a fucking autopsy, if anything. Alright, well, you're fucking fine, Grandpa. You are fucking fine. We got a full waiting room. We don't have time to sit around and look at your brain all day. Whoops. There it is. I'm glad I don't live in Needle's world where spider and brains is a common diagnosis. You're already there. Let's see. Let's do the patient AI. 29-year-old male sent to ED for urgent care with abdominal pain since yesterday. Shit, hang on. Oh, excuse me. Oh, look at how sad he is. The patient is in the ED due to worsening abdominal pain and poor appetite, which began yesterday and led to a referral from urgent care. It's important to consider a thorough physical examination focusing on abdominal tenderness and to order relevant tests such as a CBC was differential. An imaging to confirm the suspicious diagnosis. Okay, I know this one. I know this one. You know how I know this one? Because this happened to me. Did you eat anything, and did you fall on a 20-inch non-specific latex object with a flared base? Actually, it wouldn't have a flared base if he was in the ER for it. No, I know this one. I think he's got fucking appendicitis. That's what happened to me. I went to the emergency room because I was I felt really nauseous and my stomach hurt, and I wasn't hungry at all. The patient's nausea is getting worse. Can you write for something? Sure. Here we go. Yeah, take your antiemetic. You'll be fine. Now let's see. When did the symptoms start? Started feeling the pain yesterday. Are you experiencing loss of appetite? How bad is the pain on 1 to 10? Around a 7? Damn, that's pretty bad. My pain was probably about a 7 or an 8, but I lowballed it and I said, 4 or 5. Because I don't want to give like a really high number and then have the pain get really worse suddenly. But also, when I did have appendicitis, my mom had like some painkillers laying around, like some fucking what do you call those? Fuck, I'm completely blanking on the name. Oxycodone, like Oxycontin. She had some Oxycontin laying around from an old dentist visit. And I took one half of those because the pain was so bad, and by the time I got to the emergency room, I wasn't feeling anything anymore. And I had to tell the nurse who was trying to give me a fentanyl. I was like, no, I don't need it. I don't need a fentanyl. Because I was worried that combining the two would make me explode or something. And I didn't want to tell her I took I took somebody else's fucking Oxycontin. Let's see. How bad is the pain on 1 to 10? Are you experiencing pain near your lower right quadrant of your abdomen? Hurts more on the right side. That's appendicitis. Does it hurt when you press it? It does hurt when I press on it. That's appendicitis. When did you last shit? I mean, have a bowel movement. I haven't had a bowel movement in a couple of days. Uh-oh.
Code blue, hospital lobby. Code blue.
Are you on your period? No, I'm a guy. Hey man, it's 2025. Guys can have periods now. Get woke, bro. I don't think that's the case for me. Well, good. Let's see. Abdominal exam. Right side pain with palpitation of the LLQ. I don't know what that is. RL? Oh, lower left quadrant. Okay, there we go.
Code semi, cath lab activation. Code semi, cath lab activation.
Now let's give you a blood panel. And also a CBC. Oh my god, that looks bad. Oh goodness gracious, you got a shitload of white blood cells. Ask him if he's had a history of irregularity. Have you been taking your Activia, man? You've been eating your Activia every day? Is the old lady from the Activia commercial still alive? That wasn't fucking what's-her-face, was it?
Room 1. Code stroke.
The gay woman. Fuck, her name's on the tip of my tongue. The gay woman from Glee. Jamie Lee Curtis, that's it. Yeah, she wasn't the one. She wasn't the one in the Activia commercials, was it? Was she? It was just another old lady with gray hair.
Code blue, hospital lobby.
Oh, she was?
Hospital lobby.
Huh. Oh, Jane Lynn. Oh my god, those are two different people? Holy shit, those are two different people. Oh my god, they're two different people. Holy shit. I thought they were the same person. I feel like I live in a new world, a different world. You know, that happens a lot to me. I don't really know a lot about celebrities or famous people. So that happens very frequently to me, where I will conflate two people in my mind, and somebody will be like, "Wait, those are two different people. That's not the same person." Like that happened to me with Timothy Chalamet and the Spider-Man twink. It took me like 2 years to figure out those were two different people. At least you sort of remember them. That's something. I said this recently. I think I might be a little bit face blind. Just a little bit.
Dr. Bhatia, hospitalist is holding on extension 3500. Dr. Bhatia, hospitalist is holding on extension 3500.
Pisses. No, not the urine culture, the urinalysis. Because it's not. I don't remember faces so much. I remember, like, attributes. I remember, like, traits about a person. Well, let's put that IV in there. Put the monitor on. Holy shit, your heart rate's quick.
Code blue,
You nervous, buddy?
code blue, hospital lobby.
Just uncomfortable with the pain. Sounds like you could use some medicine. Let's give you some haloperidol. I've heard of it, but I don't know what it does. Let's see. Acetaminophen for you. There we go. Get that heart rate down.
Room 1. Code stroke, room 1.
I gave the acetaminophen, but that may not be enough to address his pain. Let's give him a little bit of morphine. There we go. You take that. Dr. Needle's scary. The patient's pain is getting a little better after treatment. That's good. Don't be scared of Dr. Needle. She's good for you. I remember faces in an abstract way, but if you ask me what somebody's hair color is 30 minutes after they leave, I won't know. See, I can remember hair color.
Code stroke, room 1. Code stroke, room 1.
Let's see. What else do you need? We didn't do the CT scan. Let's fucking... Yeah, abdomen CT. There's a non-fluid filled edematous appendix consistent with acute appendicitis.
Dr. Beverly, please report stat to room 10.
If you say so.
To room 10.
There we go, appendicitis. This one's easy, because I just remember what they did to me. It said something about doing CTs with and without contrast. There is no contrast option for me. Solid sepsis instead of liquid sepsis.
Hospital is holding on extension 3500.
Metal Gear.
Hospital is holding on extension 3500.
I don't know, are you done? How about an MRI of your abdomen? Unnecessary! Angry! I'm just checking, man! I just want to get a fucking double check on this shit. Check him for a hind D. The surgery is finishing in the OR, but based on the CT findings, they recommend sending the patient to the OR. Appendicitis. Prep for operating room. Done. Yes. Yeah, dude! Can you fucking believe it? I fucked up the physical exam. What did I need to do? Back flenderness, genitourinary exam, hint exam, cardiovascular exam, pulmonary exam. Basal pneumonias can present with abdominal pain. It is reasonable to perform a cardiopulmonary examination in patients with abdominal pain. Really? Needle, my roommate just asked if you were a VTuber. Tell him no. Tell him no, and I resent the implication. So I was supposed to check him for testicular torsion, and I didn't. Fucking many such cases. Interventions. What was the other thing he needed? Antibiotics, yeah. Well, I thought about giving him antibiotics. But, you know, I figured he maybe needed that. After the surgery, maybe. Did you know they can cure appendicitis with just medicine these days? That's what they said to me when I got my appendix out. Like the nurse poked her head in, and she was like, "Needle, did anyone tell you? Did anyone tell you what's going on?" And I said, "No." And she said, "Oh, you've got appendicitis." And I said, "Oh, okay." Like, I don't think they gave me antibiotics first thing. I think they did that after. Don't get appendicitis, by the way. I don't recommend it. Acute appendicitis is one of the most common conditions leading to emergency abdominal surgery. It is caused by an obstruction of the vermiform appendix, a blind-ended structure that arises from the beginning of the colon. In children, intra-abdominal lymph tissue enlargement compressing and obstructing the appendix from dehydration or viral infection is a common cause. Fecalifts may also be the trigger. Yeah. Jesus. VTuber. I'm having to open a new fucking incognito tab every time so I can, refresh my unlock tokens. So I can have the fucking the honor of getting to read this shit. We just got two more left. Let's do these rest of them. Found lethargic by roommate. 28-year-old brought in by her roommate due to lethargy and decreased responsiveness. History from roommate. 24-year-old found lying on couch very difficult to arouse. Oh no! Are you sure she's not just frigid? He carried her to the car and brought her to the ED. Patient placed in wheelchair to car. Welcome to full code. Yeah. Now, there is no conversation here. I mean, there's no AI we can talk to. Patient is 24-year-old female who was well this morning and last seen approximately 1 hour prior to arrival. At that time, patient was conversant, telling her roommate about stress in school and a fight with her boyfriend. Roommate went grocery shopping, and when he returned home... Oh, roommate. Yeah. Patient was on the couch and very sleepy. It was very difficult to rouse her. Patient barely responded with slurred speech when he kept screaming questions at her. Roommate carried patient to his car and drove her to the ED. No blood or the trauma. Of note, patient has never been to this hospital before. Roommate has seen the patient take an allergy pill, but he's not sure what it is. She drinks on weekends and has occasionally tried marijuana. You know what that means. We gotta call the patient is losing consciousness. Where is what is it called when you do resuscitation? Paddles. What is it called when you do the paddles? What is it called? When you put the electricity in someone's body to make them better? What do? What is it called? I don't remember. Resuscitation. Cardia, epinephrine, vascular access. Shit. Take this epinephrine. Chest compressions. There we go. Live, damn you.
Code 7, cath lab activation. Code 7, cath lab activation.
She is sounding a little better, but still under breathing. Here, more oxygen. Check her for signs of OD. How? Come on! She was doing better! I was given her oxygen. I almost said water. If I was giving her water, that would be a big problem. The patient's respiratory rate continued to decline, leading to a respiratory arrest. Administering a reversal agent would have prevented this outcome. Administering a deaf reversal agent would have prevented this outcome. Fucking Big Pharma doesn't want us to know about the deaf reversal agents. Well, what the fuck is a reversal? Like, which one is the reversal? Let's see. Pulmonary exam. Insert IV. Attach monitor. She's not breathing very effectively. Intubation. Prepare for intubation. I'm trying to intubate her. Endotracheal tube. Suction. Get her in. Get her in. No, come on! So, the patient doesn't need intubation, but she couldn't breathe. How do I get to the Narcan? There is no Narcan in my book of tricks. Oh, yes, there is. There fucking is a Narcan in my book of tricks. If my doctor can't figure me out, I would like some some oxygen in the meantime. Fucking where is the reversal? Respiratory. Do you want this? Do you want this? The patient is losing consciousness. Non-rebreather mask. I don't know what the reversal is! Let's get us a Narcan. No, give her the Narcan! Give her the Narcan! Oh, she's back! Oh my god, that did it! You were fucking right, the Narcan did it! Oh, she's back now! She took one of her grandmother's fentanyl patches to try it out, and regrets doing so. She's on the Fenty. She had an overdose of Fenty. Someone fucking spiked her shit. What are Fent patches for? I assume of dying. Yeah, short answer, yeah, dying. No cough, wheeze, okay, even though you just couldn't breathe a minute ago. No allergies. Well, if you ask me, just take off the fucking fentanyl patch. Go home and sleep it off. Man. Whoops. Didn't mean to do the, blood type test. Didn't someone supposedly take a swig of their friend's assisted suicide poison chalice? I remember that! Some guy fucking went to the hospital because his yeah, exactly. Yeah, I remember that. I heard that story. Let me find it. Fuck, I gotta find it now. I gotta find it now. Come on. Firefox, are you about to close? And the way you so frequently do when you get overloaded. Yo, you sure did. You sure did close, Firefox. It didn't always used to do that. For some reason, over the past, 2 weeks or so, every time Firefox freezes up for half a second, it's like, I can't handle it! I gotta die immediately. Uh-oh. Come on. Come on, OBS. There we go. Okay, give me a minute to find it. Here, look at this. Use a Firefox clone like Libowolf or Florp.
Dude, it's on Mingus. You can watch it. You can watch it on Flubber. Dude, it's literally on Bingo. Download Bingo and watch it. Poop has it. It's literally on Poob.
This is gonna be so fucking worth it for the poison suicide chalice story. Carbon monoxide poisoning was the cause of death for former Yankees of Brett Gardner's... What? Carbon monoxide poisoning was the cause of death for former Yankees of Brett Gardner's teenage son. Yankees of Brett Gardner's? What the fuck does that mean? This is one of my thought-provoking stories in Firefox. Like, if it was, Brett Gardner of the Yankees, sure, but former Yankees of Brett Gardner? That's not English. Former Brett Gardner. Like, did he fucking transition? Why are you calling him that? The best part about when Firefox closes and fucking freaks out is that then it takes like another fucking full 5 minutes to open up again. Former bread gardener. Yummy. We call that wheat farming. Yeah, look at it again. Needle, do you like Brett Gardner or Mike Piazza more? Mike Piazza sounds like pizza, which I like, so that. Okay. Great news. Involving a 35-year-old Colorado man who survived after taking sip of a MAID cocktail. What does MAID stand for? Medical aid and dying. Okay. A 35-year-old Colorado man who survived after taking a sip of a medical aid and dying cocktail. His older friend had invited loved ones to be present while he consumed the MAID preparation, according to the report. After his first swallow, he remarked, "Man, that burns!" The younger man said, "Let me see," and then also took a swallow. 35, man. MAID, we call that the Canadian Healthcare Special. Care was not rendered to the deaf with dignity patients. Would be fucked up if it did. It's like, man, wake up, we fucked up, man, you can't die yet. The man was ventilated and regained consciousness with full neurologic recovery. What the fuck is this guy's problem? Man, let me see. I wonder how much of it he took. Like, just probably just a very little bit, right? Like, if you just took a little bit of the death cocktail. If you just, like, stuck your tongue in the death cocktail. Just dip the tip of your tongue in the death cocktail, and then get a paper towel and rub it off your tongue afterwards. Don't even swallow it. Just rub it off afterwards. Do you die then? Will that kill you? Yeah, you could probably swirl a droplet around and wash and get most of the experience. I'm gonna use my kid's medicine dropper to get a sip of Grandpa's death medication. There's a story of someone who accidentally drank a bit of it and survived. That's what we're talking about. We're talking about that guy. That story was from fucking 2023, if not earlier. Which is insane because I I just heard about that story for the first time a few days ago. On like fucking Twitter or something. So I thought this the fact that it came up twice so quickly, I really thought it was something that just happened. So let's see. You got the fentanyl patch. Again, I really don't know what to do now. Just take off the fentanyl patch and you'll be fine. Apply pelvic binder. It is placed over the hips and drawn tightly across to pull an open book pelvic fracture back together. Ah. Open book pelvic fracture. Alright, good night, Jinx. Have a good night. What if you remove the patch and she gets withdrawal too quickly? Then we put the patch back on. I didn't say we put the patch in the garbage. We just take it off. I did already Narcan her. Honestly. If I was a drug addict and I overdosed on fucking, on my fentanyl or whatever, and I got Narcaned, I would be pissed off. Because that was probably like $100 I had to pay for this high. And now I'm gonna have to pay more for the hospital bill. What's wrong with this patient? Nothing. She's faking. Narcan hurts? What do you mean Narcan hurts? Like it hurts going in? Oh, and the sense that it causes immediate withdrawal. I could see that. I mean, you probably don't feel great anyway. It doesn't have to go up your nose, though. You can, there's like a Narcan, like EpiPen, right?
Dr. Batia, hospital is holding on extension 3500. Dr. Batia, hospital is holding on extension 3500.
There was a remove patch option. Are you kidding? Are you just fucking with me? Holy shit! Son of a bitch, you were right! And it was just tucked in the middle there. Like, you wouldn't see that unless you were looking for it. Okay, patch is off. Don personal protective equipment, yes. She might still have some of that residue on her. We don't want to overdose ourselves. We gotta put the hazmat suit on. Decontaminate. There we go. Now all the fent is off here. What is this? Oh, here we go. Well, that's helpful.
Code semi, cath lab activation. Code semi, cath lab activation.
Well, now it tells me, now I know how I can access what I still need to do. How many? Fucking 13 critical actions for her? Nice of you to fully decontaminate the fin in case a cop ever comes to the hospital. I know, you know. All in a day's work for Dr. Needle. How about some saline? Do you like that?
Dr.
No.
Bevelich, please report stat to room 10. Dr. Bevelich to room 10.
Perform psychological exam. No, she states that this was an accident. Uh-huh. Likely story. That's what all the suicidal people say, so they can get back out and do another suicide. Well, 8 out of 13.
Code blue, hospital lobby.
Can I give her like a psych screening? Like, I mean, I guess she doesn't need it if she says it was an accident. Discharge was Ativan, discharge was intranasal naloxone. Well, I don't think she needs that. How about I discharge her with nothing? How about I send her to the fucking cops for doing marijuana sometimes? How dare she admit that to me?
Code semi, cath lab activation.
What is your final diagnosis? Oh, yeah. Environmental. Black Widow spot. Human bite. Dog bite, cat bite. Adrenal crisis. Where's overdose? There we go. Opioid overdose. There we go. All done.
Cath lab activation.
Said all done. Yay! We're getting solid like C's and D's on this, and you know what they say? C's get degrees. What do you mean I shouldn't have discharged her with Ativan? I was supposed to give a discharger with more fucking Narcan. She said she wasn't gonna do it anymore. And I mean, it's not like she has a history of this shit. She was just stupid. It is essential to ensure the patient has a patent airway and is able to maintain it. Well, I mean, I think if she couldn't maintain her airway, I think, you know, I think there might be some other signs of that. Pulmonary exam, skin exam. Oh, skin exam. I guess the patch would be on the skin, wouldn't it? What's Ativan? Ativan is like an anti-anxiety medication. I didn't see an option to discharge it with no prescription. Uh-oh. Clicks a slider. It's already odd easy. Yeah, I couldn't discharge her with nothing. It was telemetry. I could admit her to the regular hospital or admit her to the ICU. What is telemetry? In a hospital, a telemetry room, also known as a telemetry unit, is a specialized area where patients, typically those with cardiac conditions or have recently undergone cardiac procedures, receive continuous monitoring of their vital signs, including heart rate and rhythm, using electronic devices. Well, she didn't need that either. Shit! There we go. There's a fucking ant. I got the ant. Well, you're done. Whoops. Needle the belly button. She's fine. Don't kill ants. They release pheromones that attract more. What should I do with it? I mean, fucking ants leave pheromones that attract more when they're just walking around. Throw it outside? I have to fucking walk all the way outside to throw it outside? Sounds like a lot of effort to go through for an ant. Fun fact, Dr. Mario is not a licensed physician. Even though he charges like one. Let's see. We got one more of these. I had to download fucking Google Chrome just to play this, by the way. It is not compatible with Firefox for whatever reason. Now this final one's gonna be interesting. Because unlike the previous ones, where we were, you know, trying to diagnose something, 21-year-old male with a gunshot wound to the neck, currently breathing independently and able to speak. We know what his problem is this time. We gotta figure out how to treat it, so it's a little bit different. Pain and swelling the right side of the neck. See collar not placed due to direct pressure being held. Denies other pain or injuries. Gunshot wound to neck is surprisingly non-specific. I mean, how much more specific would you want him to be? Whoops. Looks like this guy's been eating Cheetos. The flaming hot kind. Patient is an otherwise healthy 21-year-old male presenting to the emergency department via an EMS with a gunshot wound to the neck. Says he was involved in an altercation with a stranger outside of a bar. According to the patient's account, the stranger pulled out a gun and the patient started to run away from him when he heard several gunshots. Patient then felt severe sharp pain in the right side of his neck. The shooter fled the scene. The patient was able to call 911. Shit. No, I got fast, and I just saw fast, and I got excited. I was like, fine, do it fast. Code
Blue, hospital lobby. Code blue.
Oh, there's a code blue in the hospital lobby. Come on. Come on. There we go. He needs it. He needs it now. His neck appears to be more swollen.
Code dummy. Cath lab activated.
He needs acetaminophen.
Cath lab activated.
Acetaminophen for swelling. Give him morphine for the pain. Needle the bleeding. What bleeding? I mean, what do I need to do with the, what do I need? Oh no, I gave him lidocaine by accident! Oh, he needs blood! He needs blood! He's got O positive blood. Blood! He needs blood!
Code blue. Hospital lobby. Code blue. Hospital lobby.
How do we get the bullet out? Where is extract bullet? Let's do a head and neck CT. Here we go. Puncture wound to the lateral posterior and medial anterior right neck with air tracking through neck consistent with gunshot wound. Subcutaneous area around trachea consistent with tracheal injury. 2 by 3 centimeter fluid collection with visible extravasation adjacent to the right external jugular vein. Airway exam.
Dr. Febowitz, please.
A pulmonary exam.
Room 10. Dr. Febowitz to room 10.
Tachypnea. I don't know what that is. A cardiovascular exam. He's fine. Head and neck exam. NCAT. Pearl. Oropharynx intubated with ETT 2 centimeter at the corner of the mouth. I don't know what this means. How's your skin? Mild oozing of blood. Oh, God. Ball fondle. They shot him in the ass.
Dummy. Cath lab activation. Code dummy. Cath lab activation.
You got one in your stomach? No. Okay, that's good. You really do have to check the balls every time. Whoa, don't insert a chest tube. No, take that out. Take that out. No, he did that by accident. Take it out. He doesn't need one of those.
Hospitalist is holding on
Well, I guess now he has one.
Dr. Bacchio, hospitalist is holding on extension 3500.
Communicate. Let's communicate with otolaryngology. How is the patient's airway? I don't know. It's intubated with 8.0 ETT inserted with 2 centimeters at the lip. Here, surgery. Send him right now. Done. What is your final diagnosis? He got fucking shot by a gun. Gun. Gunshot. Shot. Shit, that's a good idea. An MRI. He needs an MRI of his neck. MRI is not an option. Oh yeah, because of the magnets. That would be a problem, wouldn't it?
Code blue, hospital lobby. Code blue, hospital lobby.
Neck hematoma. Penetrating neck injury. Fuck yeah! That's the best score so far. 75. Can you believe it? I'm going straight to the fucking hospital after this. And not for a bad reason. I'm gonna make him give me a job. Interventions minus 20. I gave him a chest tube on accident. That won't happen in the real world. In the real world, you don't accidentally press a button and accidentally give a guy a chest tube. There are more steps involved to it than that. Imaging can delay care in unstable patients. What else did he need? But he needed an x-ray, but fucking imagery delays care in unstable patients. I guess we got him stable. Well, this is a example of a penetrating neck injury. It also incorporates several of the basic principles of trauma evaluation and resuscitation. For this reason, we will do it as a quick review of evidence-based trauma management as it relates to the case. Airway, breathing, circulation, disability, expose. All patients with significant trauma should be undressed and examined head to toe. Like, completely stripped? That's a little much. I did find that though. I found the extra wound in his ass, the extra gunshot wound in his ass. So I did that. I bet a lot of people didn't get that. What was the benefit of the ethanol test? They didn't sedate him at all. They didn't give him any fucking paralytics, so he was just... he was thrashing the whole time, but we got him in. Lidocaine, unnecessary. Chest tube, harmful. It was a fucking accident, man. Administration of TXA in the trauma patient may confer a small mortality benefit. That's just a small one. He needed a tetanus shot. He did need that ultrasound, though, so even though I clicked on that by accident, it was right. ethanol level. Trauma patients have a higher incidence of concurrent intoxication and drug use. Yeah, they wanted us to make sure that he didn't get into a fight because he was a wino. Contact vascular surgery. I always forget about vascular surgery. Well, I feel like I've learned a lot. Do you feel like you've learned a lot? I feel like I'm ready for my new career in the medical field. Yeah, I'm ready to do surgery too. Let's go. Let's go find somebody to do surgery on right now. I'm sure somebody needs it. Now. If you'll excuse me for a moment. I'm off the clock now. I don't need to wear my fucking head reflector anymore. I just had to go into my dressing room for a minute. Don't worry about it. Now, I'm not ready to end quite yet, so we're gonna do what I said we were gonna do yesterday. Shit, how do I... Not yesterday, but hang on. There we go. Okay. We are going to do some fucking Pokemon Showdown with the April Fool's sprites on. I'm gonna take a minute to get some more water, take a piss real quick, and then we're gonna come back and play a little bit of Pokemans. So you just sit and wait warmly while that happens. And smoke a ciggy? No. Cigarettes are bad for you. Remember that, 2 hours we spent looking at the, drug and sex education prop shop? We learned that drugs are bad then. Because of that fucking baby doll head in the vase. So while I do this, I have a very, very special gift to keep you occupied while I'm gone for a minute. Hey, you enjoy this. I'll be right back.
Cars hurt little children, cars hurt little kids. And if there's not a kid in sight, they aim for something else that might just squash. Just watch. Now if you were an orange, there'd be nothing left to eat. Just remember this story when you're walking down the street. Cars hurt little children, cars hurt little kids. And if there's not a kid in sight, they aim for something else that might just squash. Just watch. Now if you were a googie egg, there'd be nothing left to beat. Just remember this story when you're walking down the street. Cars hurt little children, cars hurt little kids. And if there's not a kid in sight, they aim for something else that might just squash. Just watch. Now if you were a sausage, you'd be mushy, mushy meat. Just remember this story when you're walking down the street. Cars hurt little children, cars hurt little kids. And if there is a kid in sight, she waves at me 'cause she's alright. She's crossing at the traffic light and everything is fine.
Light's red, you dumb bitch! I mean green. I mean... Oh, I fucked that up. Yeah, light's red. Run the red light, Minnie. Let the fucking oncoming 18-reeler come plow into you. Do it. Fucking do it. You saw my bookmarks. What are you gonna do now that you saw my fucking bookmarks? How was the shit? Didn't shit, just pissed. I wouldn't lie to you like that. I wasn't looking. You could have looked. I don't have anything incriminating in here. I mean, the worst thing on here is the fucking paywall reader, but this doesn't even work half the time. Oh my god! Sonny's the lion! Thank you for the raid! We just got done with the fucking medical simulation game, and now we're gonna be playing some fucking Pokemans. You like Pokemans? How was your stream, Sonny? Leave now before it's too late. She's gonna play the... No, I'm not. I don't have the video anymore. I closed it out. We ballooned our brains out? Oh, good. I've never tried balloons. I hear a lot about it. It's one of those really addicting... It's bad. Balloons has a monkey in it? A monkey? It's bad. Has 2,000 hours in it. Many such cases. Many, many such cases. Just fucking look at this. Like the shifty eyes. Like Minnie Monkey is a danger to the people around her. And not just because of her anti-doctor sentiment either. Goes a lot deeper than that. The Minnie Monkey's away, but a narrow. Don't cry. Minnie Monkey can't hurt you. Minnie Monkey's not real. She can't hurt you. Ranbats! Yeah, if you haven't seen the Pokemon Showdown April Fool's sprites, these are, you know, this is about what the level we're looking at. But shit, Stealth Rock. When in doubt, you always do the Stealth Rock first. Many Monkey made me afraid of cars. I mean, she fucking would! Her whole song is about how cars live to plow down little children. And when they can't find a kid, they just go for the next best thing that'll make a satisfying splat under the wheel. It's fucking scary. And so it begins. Fucker! Yeah, get fucking miss. Get, fuck you. That's what you get. It's gonna keep happening. Generate blue Santa bird robot. Okay, that's okay. Okay, I like that. I'll give him that shit. I'm already doing the encore, idiot. Hungry Hippo Yellow, very powerful. Hungry Hippo Yellow got banned for being OP. He did what he needed to do. He is satisfied his He's fulfilled his purpose. Why is my bird moving? Oh, it stopped. But you did see it, like, moving a minute ago, right? Also, hello, Lobotomy Bunny, what's up? Hope you're doing good. Oh shit, I forgot about that fucking ice move. These sprites are amazing. They are! These are the April Fool's sprites. They're very a lot of fun. I don't want to use all my roosts, but I'm gonna do it again. Ah, yeah. I didn't even have my flying type, and you still couldn't kill me completely. I'm gonna. Oh, fuck. I'm gonna hope that it does close combat again, and I'm gonna go into Gengar. Did I read it right? Did I read it right? Damn it! Curse you, Gen 7. I'm not sure what they're getting at. I'm faster than it, but I don't think I can take whatever it's gonna fucking do to me. Just Shadow Ball. I'd like to do something with Jumpluff, but she doesn't have any fucking decent moves. And she's gonna get fucked over by poison attacks anyway. Shit, I don't have anything I can do to this guy. Petcharunt, get it? Petch? Princess Petch? God damn it! I'm not being smart about it. I'm not fucking being smart about it at all. Petcha cunt. God, I fuck. Oh. I legitimately didn't think I had that little time left. Oh. Fucking whatever. Battle timer is such bullshit. How about you give me a minute, man? Or how about you reset the timer every time? Don't have it be like, oh, you have 120 seconds total. Well, I don't. This looks completely normal to me. I'm trying. I'm thinking, man. Yeah? Oh, okay. Oh, that's what parting shot does. It fucking gives him a chance to switch out. Okay, I get it now. Fuck you. Fuck you. Get out of here. Get out of here immediately, Link. That elf boy is stealing my keys. Let's get the fuck out of here. Just because you're dead doesn't mean shit doesn't matter. You know, I can vouch for that, actually. After my grandma died, like this was a while ago, the fucking bank kept trying to like, I don't even know what it was. They were trying to get her to keep paying her mortgage even though she was dead. And it was a whole fucking thing. Like, that's... You'd think that when you'd get back to these people and tell them, oh, sorry, this lady is dead now. She can't give you the money you want. She's dead. You'd think that would do something. Doesn't. What even is mortgage? It's bullshit is what it is. Pay no attention to what's behind this sign. Oh, I think I might. God damn it, Gyarados! Don't let him get his fucking slow start on, man. Kill him. Reggie Gigas got its act together. Shit. And I don't have anything faster than this fucking thing. Excellent. I'm gonna get fucked over because Gyarados had to get paralyzed at the exact wrong time. Who is your favorite Pokemon, Needle? That's hard. That's a hard one because it's hard for me to just pick one Pokemon because I like many Pokemons. Phantom, really? Phantom's okay.
Where you going, mate?
Where indeed? Yes, yes, yes! That was fucking dirty, man. He fucking used substitute even though he knew he didn't have enough HP just so my sucker punch wouldn't work. That's dirty, man. That's playing dirty. I like Dragonite and Gligar too. Son of a bitch! I'm gonna do this how many fucking times it takes, man. I'm just gonna start naming Pokemon that I like. Let's see. I like Azumarill a lot. I like Azumarill because she's useful. She's both useful in battle and cute. Which doesn't happen very often. You know what Pokemon I really like? Misdreavus. I like Misdreavus a whole lot. Yeah, it's not gonna work this time, asshole! The fuck is this? It's a fucking DK rap. Live, live, live! You just needed to live one fucking... Just one fucking one of those, idiot. You made him into Sonic? Why? Just because he's got spikes on the back? You can do better than that. Let's see, I like Azumarill, I like Misdreavus. Oh, you know what Pokemon I like? Fucking Poplio. Poplio is my favorite starter.
You just gotta love him.
Cyndaquil is the GOAT. Cyndaquil's not even best in that generation. That, of course, goes to beautiful, fair Chikorita, who is also one of my favorites. You choose the water starter every generation. See, I don't like limiting myself like that, you know? I choose whichever one I like best. Well, you're our last hope, Victory Bell. I don't know what the fuck you got, like, shoes on your head for. Hello, male VTuber 9000. I did the, I've done, like, the math on it once. My, like, distribution of starter types is almost, like, completely equal. Like, I think it might be, like, in terms of least to most use, it might go grass. Can you ban this guy? Fuck you! You can't say hi in here, asshole! Ban him, he's a male VTuber. Ah, fuck no! Well, if we're gonna ban him, we have to ban male VTuber 1 through 8,999, and that's a lot of people to ban. That's weird. Is this the scene I have up? Where's... Oh, that's what that is. You can't spell but an arrow without ban. Damn, you have a really good point, male VTuber. I think you're both getting banned. Sorry, I was confused about my scenes for a minute. Look at all these pogues. Oh, I like Wigglytuff. Ban a Nero! It's right there! Fuck, you gotta change your username now. I love Wigglytuff a lot because she's just Jigglypuff with rabbit ears. Oh, Snubble! Snubble's cute. Oh, and I also like Flaffy. Flaffy's cute because she's a sheep that's pink, just like Flaffy. Snubble is a dog that's pink. That's a recurring theme in my favorite Pokemon. Who is the cutest Pokemon? You can't make me pick just one. Who is the sexiest? I think we all know the answer to that one. And this might be... This is an uncommon choice, but you know what Pokemon I really like a whole lot? Smoochum. I love Smoochum. She's cute. I also like Hitmontop. Hitmontop is also cute. I don't know if I describe my feelings for Armaldo as like, but I definitely think about him a lot, if nothing else. Just because his fucking name is Armaldo. And he looks like this. If you don't render Jinx so she looks like a bullet, she kinda bad. Are you fucking... Are you fat-shaming Jinx? Is that what you're doing right now? Do you also have to be banned? Oh, Mime Jr. I'm not fat shaming. I'm no neck shaming. Oh, so you're being like ableist or whatever. Hang on, give me 1 second. Here we go. What's wrong with fat shaming? It encourages people to become healthy. It really doesn't. I mean, it kind of just encourages them not to talk to you. Oh, Gosita's cute. Gosita's like Smoochum. Even better. Gosita's like Smoochum if she was a goth loli, which I think is just so beautiful. Slurpuff's cute. The Dene's cute. I like the Pika clones. Oh my god, beware! I love Beware. Oh, the cake, you mean, Alchemate? She's really more of just a frosting Pokemon than a cake Pokemon. No, she's really more of a cum Pokemon, you know. But I think if I was gonna have like a Pokemon team, like an official Pokemon team, the official Needle team, I think it would be Beware, Bennett, where is it? The fuck is it? Mimikyu. Oh, I know. Needle King. I gotta have the Needle King. Needle's gotta have the Needle King. And speaking of needles, we also want to get Toxapex in there. And rounding it out. Rounding out the team. Ice Cube. Love him. People are so mean to Ice Cube. People think he's such a shitty Pokemon just because he's a penguin with a Minecraft head. But I love him. He's cute. He's adorable and cute. Yeah, the Flamingo is worse than Ice Cube. At least Ice Cube is different from a normal penguin. He's set apart. In that he has a big fucking block of ice on his head. Flamingo is just a fucked up flamingo. It's just a fucked up flingo. Yeah, everybody wants to fucking redesign Ice Cube. And he fucking completely loses the plot of what Ice Cube is. This kinda gets it. This kinda retains the idea. You just want Ice Cube to be cool and badass. Fuck you. Let him be fat and weird and wobbly. And waddle around like a little idiot. He can do that. It's fine. It's fine for him to do that. And he's also pink, which is the best. I mean, he can be pink when he's shiny, which is the best color. Sawana lose? Oh, don't. You don't hype me up like that, Swana. You were setting me up for major embarrassment. I don't think he's gonna stick out. Stick out though. Fuck, hydro pump. Just do it. Just do it. I knew that was gonna happen. I knew fucking something like that was gonna happen. Brave bird. When is Nintendo gonna release the Pokemon MMORPG we've been waiting decades for? That I would pay $100 for. Wasn't there a fucking Pokemon MMO in development at one point and it got canned? I feel like I heard about that on like Did You Know Gaming or something. Okay, Weavile. Just move quicker than this guy. Ha, fucker! Die! I don't know, people always talk about a fucking Pokemon MMO. I don't know if I'd be crazy about it.
Gallade. Get it? Gallade.
Shit! Do you not like MMOs? It's not that. I'm not I haven't played any MMOs in a while. Polite child, Dufo. When I picture a Pokemon MMO, I think of the Ghostbusters 2 MMO in Homestuck. How would you make it work feasibly? That's what I'm saying. Like, I guess you could make it a fucking, like, maybe like a Final Fantasy thing. But Pokemon just feels like very intrinsically a one-person experience to me. Like, if you want battling, that's fine, but I feel like that's something different. Among Us. Sus. Very sus. Oh, he gets it. What do I do? Just keep doing it. Yeah, well, wake up! Fuck yes! The first few worlds, yeah, but get some AI trainers, and after that you'd have issues like places to go and things to do. Yeah, that's what I mean when I say Pokemon is the full, first player experience. And I guess it's kind of... vented. Sad. Shit! I mean, admittedly, I haven't played whatever fucking Final Fantasy the MMO is. Like, is that 14? Admittedly, I haven't played that, but that has a thing where you're like, what do you call it? The hero alike, that's it. Like, how do they make that work with the multiplayer aspect? Sorry, I'm trying not to... Oh, asshole! This was most mind you. That was you're welcome. Intentionally wrong you're, just to piss him off. Here you go into the glitch dimension and Gary the Dick is there. I don't know. I just don't know. I don't know about the Pokemon MMO. Maybe if I was more of an MMO player, I'd be able to have something more substantial to say about it, you know? But like right now... Giratina is so cute. Giratina is gay. No, he cute. You automatically assume gay is bad thing. Wow. Get woke, bro. Second time I've used get woke, bro, tonight. Now let's fucking see. What the fuck am I supposed to do about this Zapdos and then the rain? Bro, I am trans and lesbian. There's a good chance I am the gayest of us. Okay. I'm happy for you. I should have sent out that fucking Electros. What the fuck am I doing? They fucked me over with the gay Giratina talk. I mean, I guess I did that. Did you ever hear the tragedy of Dark Plagueis Sawai's? Okay, I don't want to play this game with him anymore. Giga Drain's not gonna work because it's fucking... How's your fucking boosted hurricane now, asshole? Go ahead! Use the roost! Do it! I'm gonna sit here all day! Did you ever hear the Legend of Thor Technoblade the Great? I don't watch Minecraft YouTubers. I am not 13, sorry. Sad. They should be sad about that. They should be sad. Well, I'm fucked. Needle, you seem to be getting energized by the competition. Yeah, I was, then the battle turned against my favor, and now I'm not. Holy shit! Live! Live! Yes! 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 Am I faster? I gotta be faster. Do it! 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 Yeah! Fuck that guy. Fuck that guy and his fucking Minecraft YouTuber. You are falling asleep? Wake up! No sleeping on the needle stream. Wake up! Your job is to wake up and watch me win. Fuck. But your voice is so ASMR. I don't know what the fuck you're talking about. Man, I got so excited. Horse. Oh, that's a good sprite. Here, have this. Let's see. Let's get Meowscarada out here. Oh man, it's a shame. It's a shame we're only getting the backside of the Meowscarada, because that's one of the new April Fool's sprites I actually saw. Don't, god damn it! How was that fucking thing faster than me? Get the sex lizard out here. Weren't you just complaining that you couldn't go to sleep?
I guess this is what I fucking deserve, huh? Shit. Gotta get the sex lizard out of here. So, hey, I got the fucking flingo. We were just talking about flingo. Shit. Quillfish. Oh, he's cool. Oh, he's got the carrot. He's got his little carrot. Good for him. Good for Quillfish. Yeah, I fucking hate that video. I hate the sound that fucking fish makes. Like, it causes me to be viscerally uncomfortable. Like, it really bothers me. That fucking whoops. Whoops. That fitsy on. Good. I wasn't talking for the last bit of it, so I'll give you an extra 20 seconds. Here we go. Oh my god! experience. Exactly what I'm looking for. What the fuck? But I'm water type. But I was water type. How did you get to do that when I'm water type? That's kind of fucked up. Oh shit.
Okay. Now you definitely got what you paid for. I really don't got a lot here. Glare. Just make it stop moving. Maybe that'll help. I get so so excited at Pokemon Showdown. I know I get excited about a lot of things, but fucking Showdown in specific. Yeah, fuck you! Fucking switch right into my rock type attack. Fuck you. I'm gonna lower the volume and sleep. Good, have fun, Needle. Okay, good night, Bunanero. Thank you for hanging out. I don't know how much longer I'm gonna go for. We'll see. We'll see how good my winning streak is. Now that's a Flingo I can get behind. Go Flingo, go Flingo, go. Go Flingo, go Flingo, go. Go Flingo, go Flingo, go. Don't fucking think about what you need to do. You know you're gonna sweep me with a fucking Doug Trio. Yeah, the Doug Trio. So don't even pretend to be thinking about it. Asshole. And he's also faster than I am, so I'm just gonna get fucked either. Whoa! Wasn't anticipating, fucking Glare to do anything. Thanks, Sandaconda. Thanks, Mr. Pretzel. I don't know why you were a pretzel. If all he can do is Sucker Punch... No, he's gonna... There we go. Yeah, that was... Okay, that was worth it. I was thinking, do I do something fucking weird and convoluted? And, like, trick him again to get my choice band back and then use the choice band to fucking, like, accelerate my, double edge or something? But, no, just do it easy. Just do it easy style. Hit that double edge. I don't want to use double edge because it's gonna kill me, but I also worry that nothing else is gonna do enough damage to get rid of the Swampert. Shit. I gotta go for it. Damn it! Took a risk. It was wrong. Twas incorrect. It's just you, Furret. It's just you against this pure fighting type, buddy. You can do it. You can fucking do it. Great. I feel very strongly about this. Fighting moves should be super effective against Bug. Because what the fuck do you do with bugs? You smack the shit out of them till they're dead. That is the Pokemon opinion upon which I feel most strongly. Or sprays crazy sounds on him. That's not a type. We can use it! It's totally fine to use it. Alright. Get that fucking bullet seed on, Tinchino. Do you have, you have Technician, but you also have Loaded Dice, which does what the, that other move thing, Skill Link. So functionally, you have Technician and Skill Link, kinda. No, I just noticed this is Smash Brothers. Oh god, GG's. There we. If you only hit 3 times, Chinchino, I don't know what the fuck I was gonna do to you. Oh, yum. Yummy delicious. Am I faster than this thing? Bullet Seed won't be super effective because of the poison. There we go. Let's get out of here. And... oh, here we go. Iron Crown? Iron Crown? Who fucking made this shit? No, what I was gonna say... he doesn't have the timer on, so I can do this real quick. I was gonna show this for the other thing. Meowscarada's April Fool's sprite is, it's pretty good. And I was disappointed we didn't see the whole thing of it. Let's see. Psyshock again. Just keep doing it. Tim Burton, my beloved. I always forget was that a Tim Burton movie? Oh yeah! Fuck you! Yeah, it kinda had with it a fucking Tim Burton movie. Why? I don't know why I can easily see it being one. Shit! I should have been faster than that stupid thing. Actually, I do know why I can easily see it being one, because it's fucking a nightmare. Yeah. I gotta stop falling for the meme sprites. They get me every time. Alec Baldwin was in the live-action Cat in the Hat? It was Bo Welch, who was a collaborator of Burton. Oh, you got a chino too? We both got chinos. That's so beautiful. Beetlejuice, Ghostbusters 2, Edward Scissorhands. Men in Black. The strange thing is that film had, like, you know, decent talent behind it. But it still turned out like that. I'm going for it. He's gonna use a fighting move on me, and I'm not gonna let him. Oh, he didn't use a fighting move on me. Stop! Stop! Yeah, I know Scissorhands was Tim Burton, but I'm just looking at Bo Welch's Wikipedia page. Chino against Chino? It's not Al anymore.
Pew pew.
Let's fucking see. Hydro pump. Shit! I forgot about bullet seed! Am I stupid? I think I might be stupid. I think I might very well be fucking stupid. We've all thought about it. We've all thought the possibility was there, but I think it's been confirmed. I've said it before, even. Nobody likes a fucking know-it-all, man. Woozle. I'd go Chomper here. What? Is that like a, you know... That looks like a reference to something, but I don't know what it is. Chomper? I hardly know her. Hello, Moody Orange. Welcome back. Fast! That's the second Sonic reference. Sorry, Sonic reference. It was so fucking... It's frankly obscene. You're a magical girl? Yes. It's fucking frankly obscene that the Sonic movie did those, cute little nods to the Sonic meme. Like, didn't, like, the fucking, second or third one have a Ugandan Knuckles reference in it? When I go searching Chomper here, a Facebook comes up from Smogon University, a Pokemon Facebook account. That meme was never funny. Like, it was... Let's admit that. It's Megan. Hi, Megan. I hate when fucking companies do that, when they try to be in on the joke like that. Like, fuck you. We're not laughing with you, we're laughing at you. It was the kind of unfunny that the least intolerable kid in class liked a lot. God, that's such a succinct way of putting it. What do you think of the Minecraft movie, Needle? What do you think I think of the Minecraft movie? I saw some concept art, where it was originally supposed to be like...
OMG epics! You got it! I think it's poggers! A chicken jockey! Flint and steel! Oh, it's fucking funny! That's from the game! I know that it's from the game! It's from the game!
I saw some concept art, for like because the original draft of the Minecraft movie. Because Jack Black, like, took over the whole thing late in production because they... because the fucking production team was like, Jack Black's great! Jack Black gets to be Minecraft Steve now, we like him that much! But the original concept of the Minecraft movie was just supposed to be like, what? Like a little girl gets isekai'd into the Minecraft universe, and she meets Steve, and he, like, tells her, like, helps her get back home or something. I think that's a significantly better concept. I mean, it's really simple. You can fucking, just mix and match the characters, and you can have, like, 8 million different movies, but it would work. It's simple enough to provide, like, a, groundwork to build off of for the Minecraft movie. Because that's why you're watching the Minecraft movie, because you want to see things so it doesn't need to be super narratively complicated. I didn't buy tickets. No, I'm not going to go see the Minecraft movie. It is technically exactly that, but it's like the worst kind of isekai. It's a little bit like that. I know it's a fucking isekai. It's also one of those things where, like, why didn't you do this, like, 5, 6, 7, 8 years ago? Like the fucking Five Nights at Freddy's movie. Like, you're getting onto this a little bit late, it seems. No, you want to know what I'm looking forward to? I, personally, just speaking for myself, I hate that the animation was done by a visual effects company. No hate to them, but it is too obvious. It really doesn't look good, does it? Like, Minecraft is already fucking 3D. It would have looked really... I think it would have looked really cool to have human characters in that environment. You know, make it a little bit more detailed, whatever, but just 99% sticking to the Minecraft aesthetic. Like, don't make the sheep in the villagers hyper realistic. Like, make them be cartoony. Like, have them look like they're actually made out of blocks and flat materials and shit. What was I saying before that? I completely lost my train of thought. Yeah, a plasticky look would have completely worked because, you know, I'm sure Minecraft sells a shitload of toys. And then you would have a fucking, you know, basically built-in design for the action figure. So that you don't end up with this. Like this. Not even thinking about Jack Black. Not even thinking about the fucking, you know, big fat fuck potbelly Jack Black figure. Jack Black gets Ozempic. Fucking look at this. It's a fucking cube and a couple of rectangular prisms. He's smooth, he's flat, he's fine. You don't need this. You don't need to give him, like, fur. He doesn't need fur, man. Did anybody see this? They're really like, really into it. The Hello Kitty movie is gonna be done by the companies that did Black Adam and Disney's Jungle Cruise.
Coming in 2028, Hello Kitty Island Adventure, the movie.
Hey, I think people would. I think you, my audience of all people, should be looking forward to the Minecraft, not the Minecraft movie, the Hello Kitty Island Adventure movie. Because when the Hello Kitty Island Adventure movie happens, I'm gonna do the stream where I fucking blow out my brains with a shotgun. And Moody Orange is gonna be there. You know exactly what it's gonna be. It's gonna be some fucking isekai shit. It's gonna be
Some little girl goes to the Hello Kitty world, or, Hello Kitty goes to the human world.
It's gonna be some dumb shit like that. And even if it's not, even if it's like,
Hello Kitty and my melody and that's Maru and Pom Pom Purin. I need to get the magic sparkle stone to get the zingy, to get the evil magic sing under control.
even if they do that, even if they did that and they did like a whole regular fantasy plot totally contained within the realm of Sanrio Town, whatever, that fucking movie would end with like a sneaky reference to like, oh no, the magic MacGuffin we were searching for the whole movie powers our connection to the human world. Look at all those people who love our Sanrio products. We are filled with a new vigor for our adventure and a new desire to achieve success so that we can give back to our fucking audience who has made us the second highest, most grossing franchise in the world. That's what they would do. I didn't know you hated Onagai My Melody that much. That's not what Onagai did! I mean, Onagai did do it, but very briefly and very tastefully. Onagai My Melody did the Earthbound thing. Okay? It did the Earthbound thing, where it called upon you beyond the screen. That's awesome. That's not pandering. That's connecting with the audience on a deeper level. Stop talking about him. Don't even allude to him. I'm gonna fucking get you. I don't know who I was talking about just now. That's what I thought. That's what I fucking thought. Kuromi is a villain in My Melody, but if they did a fucking series like that now, she wouldn't be the villain because she's too popular now to be the villain. They're not gonna show Kuromi getting her comeuppance because she's a hero now. It wouldn't make any sense. She got too popular. They'd make a fucking new villain. That's what even fucking Onagai My Melody did that. Like, even Onagai got to a point where Kuromi was too big to be the villain anymore. And when she was the villain, she had like some outside influence, being like,
oh, you gotta do this, Kuromi.
Marvel should cast Nikocado. I don't know where that's coming from, but I agree. The best parts were when she was being an anti-hero. It was! Listen, Onagai has such intense characterization. You don't even fucking get it. Like the fucking character writing, top notch. They really make you fucking feel for these characters. Very nice. 5 bullet seed? That's what I want to see. I'm excited for the Netflix show, at least. I'm not. I mean, if you like such sort of fluff shit, then fine, but... Do I have loaded? Oh no, I got Skill Link. That's what's doing it. I know it's by the mole car people. Arbok! Arbok, you fucked it up for all of us! Oh my god, there's nothing. Okay, two cannon used bullet seed a bunch of times and killed Empoleon. Or almost killed Empoleon. Empoleon used Roost a bunch of times, and then he dragged out Arbok with Roar, and his competitive got activated from Arbok's Intimidate. Is Showdown on April Fool's mode? Yes. I usually, I like to play Pokemon Showdown on April Fools, just to experience the sprites organically. But I was doing something else on April Fools this year, so I, had to turn them on. There's a time limit. And he's gonna fucking run out the clock in a minute. Oh, you forfeited, even though you were gonna win, man! You just got your fucking, Arbok just turned on your competitive. You coulda winned. You could have winned! Did you know that Arbok spelled backwards is come? Wow. What did they mean by this? Amphido. Oh my god, it's a fucking Radio Shack battle. Hello, Skeege, what's up? I didn't know Ampharos could learn Dazzling Gleam. Since when could fucking Ampharos learn Dazzling Gleam? Fuck you! Fuck you! Pokemon is for the people. Nintendo should stop making them. I don't trust the people with Pokemon. Do you see what they fucking did to Homestuck? Homestuck is a shell of its former self because of the people. Homestuck was not for the people. It wasn't for the people, but it was overtaken by the people, and they made it bad. Shit! No, he's gonna have fucking... I knew he was gonna have Ice Beam or Thunder... Frozen. Great. Fuck you, Goodyear Blimp. I'm glad there's only like 5 dirigibles left in the world. The people are not Homestuck fans? Well, not anymore. The fuck are these sprites? What do you mean? These are the official Nintendo sanctioned sprites from Pokemon Googaboo. Remember Pokemon Googaboo? It was everybody's favorite. Pal World was for the people, and they just announced something that makes me not trust the people. Is this about that dating sim? I mean, mean, you know, it's low hanging fruit. Like, we need a funny joke to do with our property. Low effort dating sim. Pal World was for the people who wanted to fuck their Pokemon. I didn't have any problems with Pal World when it first came out, but over time I started to get a little bit more cynical about it. Just because it has the Hello Kitty Island Adventure problem of people were just falling for it, you know? Like, I think sometimes people's fucking massive hate boner for Nintendo can sometimes, you know, blind them. And I know that's really funny to say now, of all times, after Nintendo just announced their $100 games. But, you know, what was going on in Pal World that felt, you know, new or interesting? And before you say, well, what's Pokemon doing that's new and interesting? At least Pokemon, you know, at least it's coming from a place where it was trying to do something different. Marginally. Like Pal World is just like a single joke that went too far. It was like, what if we saved the Pokemon and made them work in factories and shoot a gun? Wouldn't that be funny? Let's make a fucking $60 game out of this concept. Those guys made Craftopia. I didn't expect much from it. That's part of what I mean, you know? Like, people fell for it. Like, they fell for the shitty, low-effort fucking asset flip. Just because they hate Pokemon that much. Just like how they completely fell for a Nothing Burger mobile game. Because they hate Animal Crossing that much. Pal World just wanted to get sued for clout. It really seems that way, doesn't it? Like, I know this is a point of contention, you know, whether the fucking, you know, is it fucking actually illegal for what Pal World did was the fucking, you know, was the character design. But fucking seriously, man, look at this. Fucking look at it. Yeah, it doesn't matter if it's illegal, it's also just lame. Yeah, they didn't even go for the fact that your fucking plant monster looks exactly like our plant monster. They tried to fucking trademark the concept of, like, a monster catcher game. That's not how you do it, Nintendo. This was so fucking cut and dry, and you fucked it up. The Lycanroc is pretty much a fucking copy and paste. Like, fucking look at it. This isn't even a Pokemon. This is a fan design. Look at this. Fucking come on. Come the fuck on. We're gonna keep doing the one more battle till we fucking finish a match. Did they actually succeed in suing them for catching monsters with balls? No, they didn't. Which, you know, I'm glad. Let's see, what else do I have? Two Cannon, Superior, Solgaleo, Dudunspars, Appleton. Didn't they just make the designs off of images and AI spat at them or something? I think that might have been, like something they were accused of. I don't know if that got confirmed that that happened or not. But I could see it if that was the case. I mean... I could absolutely see it if these designs were churned out by putting fucking, you know, Meganium but different into fucking ChatGPT or whatever. Shit. Speaking of hate boner for Nintendo, I kinda like the Meganium. You just like it because you want to have sex with it. Because it's on 2/4 and it's easier to jerk off. It's easier to jerk off to for you. That's the only reason why you like it. Get some help. I'm sorry. I shouldn't be accusing you of that. MGM logo Pokemon goes crazy. Yeah, it's pretty good, isn't it? Honestly, I think Palworld would make an awesome stream. I'd love to stream Palworld, but my fucking computer wouldn't run it. And I don't even have to fucking buy the thing to know that. Like, I'm well and thoroughly aware that I would not be able to run that shit. I would kill you, Needle. No Fafendis. It's okay. None taken. I might kill me, too, under those circumstances. That's like if you streamed Genshin Impact to me. You're not gonna like this, but I think that could be a fun stream too. Hey, there's something wrong with my Dudunspars. This thing's just a sparse. I mean, Genshin Impact is one of those things where it's like, I want to try it just because fucking everybody is into it, and it's having such a massive impact on all the things I like. Even if I fucking can't stand how it has changed the, what's the word? How much it's changed, like, the ethos of anime character design, you know? All anime designs have a certain stink to them, a certain, like, over-designed stink to them. Fantasy stink. And you see it in everything now. Like, I think probably the best example of it is you compare fucking, you know, HoloLive gamers with HoloLive Advent. The, like, complete disparity in character design and design philosophy is insane. Like, you don't need to add a million little fucking jewels and chains and little fucking buttons and accessories and shit. Corone can just be a dog in a dress. You asshole! I said I wanted to finish a match. Like, Corone is just a dog in a dress. Mio is just a fucking wolf in a school uniform. She doesn't need to be more than that. She doesn't need... It's fine. You know what I'm... You know what I'm saying? Man. I just think you don't need to over-design them. You asshole! Come on! Here, let me show you. So let me just look at this. See, this is Corone. She's got her jacket on and her dress and her shoes, and it's fine. And she's beautiful. She's got a handful of colors on her. It's perfect. Corone might be the best fucking design in history of anything, like objectively. And then you compare this with fucking Bibu. With all her little, you know, accoutrements and little tiny details. I mean, I guess it's just a preference thing. I like the dog because she makes funny noises. I think she looks the strangest out of them. Full fucking Corone? Oh, Bibu. I think the one who looks the most out of place is Shiori, personally. Yes! Idiot. Should have used Fire Blast on me. Oh no. Penis crossed. Shit! Oh no, don't use it now! HoloLive English is weird because this switch I'm talking about it happened like pretty much right between Hollow Myth and what's the second one? Hollow Council. Hollow Prom? No, that's Iris. Like, Hollow Myth still retains some of that simple design philosophy that I'm talking about. Like, they're, you know, Grim Reaper girl, Shark girl, Detective girl. I think that's how a VTuber, if you can describe a VTuber and her design in like one sentence, like one or two, like not even one sentence, one or two words. I think that's how you make a good VTuber design. Like Bibu's what? Like rock fairy? Yeah, bear head. You know. Yellow dog. Necromancer, rock fairy, dark bird, dog. You're talking about its mascotness? Well, it's a brand. You know? Whoops. That looks like a butler lady. Which one? Nerissa? Nerissa isn't even like anything, is she? She's just like, you know, singer. Like she's just bird singer. And that's too vague. Like bird singer could be 1,000,000 things. Like is she a songbird? Is she an unrelated bird? Like what is she a fucking, I don't know, eagle? Parrot? I got a lot of opinions about VTuber designs. Hurry up, Iono! Sometimes it is good to be more symbolically complex. Fucking exactly. Skeleton dipshit. Oh, you meant like literal symbols. Like literal symbols on a design. I thought, I interpreted that the other way. I think there's a middle ground between these two things. Like, and you can have a character design that you know, gets that sort of message across while still not being, you know, has been hotel tier difficult of and difficulty to draw. Yeah, you meant like culturally. Yeah, I got that wrong. Free hug, free hug. I like hug. I will take the hug. Let's get fucking Cloister out here. Wait a minute. There's something wrong with my Cloister. I can't put my finger on it. But he's looking different these days. That did... Fuck, why did Earth Power do so much? God damn it. Should have just sent out Veluza in the first place. Yeah, that's fuck you, fuck you, fuck you, fuck you. Miss your special fucking attack that you got charged due to your special item, and then you get one-shotted. That's what you get, asshole. And now all I have is fire types. It's important for a mascot to be easy to read. I 100% I agree with you. Like, there's a science to this shit. Like, you got these core sets, all these extra jewels, your fucking million belts, your fur ruffs, your jackets layered on top of jackets, layered on top of more jackets. It's just a style now, though. I mean, what are you gonna do? You love Ravencroft and Chioi. Let's get Veluzi out here. Veluza. You brilliant. Yeah, I can't believe you fucking survived that, you crazy motherfucker! I get what you're saying, but I feel like that, I feel like that sentiment would have more... What's the word? I feel like that sentiment would have more weight behind it if these people were, like, designing their outfits. It's a little different when, you know, it just gets chosen for you. I can't believe I'm gonna die to this fucking furigograph. I just gotta do as much damage as possible. But, you know, it's interesting, when you say that, it reminds me of this one VTuber. I think she's still around. She's like she's like Japanese, I think. She's like a Japanese VTuber. She's really into space. Like, her big thing is, her niche is space. And she'll, like, stream rocket launches and stuff, and, like, stream her reaction to the fucking, you know, Space Link rocket launch. And I saw this, like, breakdown of her design. It was, like, all these hyper-specific, like, references to, you know, aerospace. I wish I could find it. Because I think you'd really like that. Here it is. Do it. Do it. Do it. End it. End it. End it all, Embor. Do it, Embor. Do it. Do it. Do it. Do it. Take the shot. Take the shot. Take the shot. You are such a pussy. You are a big pussy and oh, you motherfucker! I got fucked over? By a double? Protect? Each time Protect is used successfully, the chance of succeeding the next time is reduced by a factor of 3.
さあ、僕だよ。
I know it's gone. I know it's gone. Thank you, Hamstrudel, for the raid. I'm sorry I can't be happier about this. Gurren Viscus, thank you for the follow. Raiders. Well, welcome in, Raiders. Ved Kaczynski. Raiders, let me tell you what just happened, because you raided me, Hammy. Immediately. Oh, I was so mad I closed it out. I got so mad I closed it out. You got cheesed by some bullshit strat? It's worse than that. It was barely a strategy. I got fucked over out of my win because some stupid motherfucker managed to get off a second Protect. Even though you're not supposed to be able to use Protect twice in a row. There are safeguards in place to keep the fucking person. But I got the wrong roll. I just got the wrong roll, man. There was a 1/3 chance of that succeeding, and they fucking got the 1/3 because I guess God just likes him better than me. We're gonna do one more battle. Forgot to pray before. No, I want you to look at this. This is the replay of the battle. Look at this. Okay. You know, Reshiram faints. Reshiram faints. Send out Embor. Tear her into fire to pump up my flare blitz. They use protect. I get a little bit closer to dying, and then they get that second protect. It just makes me mad looking at it. Just makes me mad looking at it. A snake who hides after biting. Not stung to even see. I cannot see Reshiram without thinking about Justin RPG. They love each other. I support them. I support their love. I support that they love each other. Fucking Justin IPG. Let's do one more. Fucking Christ alive. Spyro Snelf, you better fucking get ready, cause I'm mad and I'm ready to go. I don't know what this is. I don't know why Sizor is a bullet with a fist. The Raichu is beautiful. I agree. Hey, speaking of love each other. Oh, I love him. You see, look at him. He's so happy. What a precious, precious boy. Now we gotta get you out of here, Reshiram. You're gonna get fucked. Executor! Fuck you. Wow, Executor doesn't even have any fucking... The opposing Landorus used taunt. The opposing Landorus said, "Your mama's so old, she has to be extracted in Cinnabar Lab." That's cute. Is that another, April Fool's thing? That's cute. Executor sucks? What the hell's your problem? I get one forfeit a night. I get one.
Yabba dabba doo!
By far the geekiest thing you've laughed at. God damn it. Shit. Get me out of here. Oh, oh, wow, damn. Who can move real quick? None of you. I mean, I send out fucking love disc, and then what? I get outsped? Oh no. This is not love disc. This is hate disc. I mean, Doug Trio's base speed is 250, and my fucking love disc is 251. So unless it's got fucking EVs and IVs and shit and speed, fuck you. I hate you, love disc. Oh my god, you lived. The hell do you mean love disc lived? El dog. I really wasn't expecting Love Disc to live. Well... I'm gonna keep you around then. You seem like you could be of benefit to me. Hey, that's my idea! Shit, what if it has fucking Focus Blast, though? If it uses Focus Blast on me, I'm fucked. I need to get rid of his substitute. That's your 2-time special attack, idiot! 18%? Get fucked! Get out of here! Leave my shit! How come that one did so much damage? Did fucking stab and critical hit do that much? Is that Koraidon's actual cry? I played Violet, so I had Miraidon. Does he really sound like the fucking... that one Hypnospace sound effect? With like the jungle drums? Man, I should have fucking just kept Koraidon out here. If I can get Clefable out, whatever, Clefable. Oh shit. I think my Clefable's got diseases. I'm so fucked. I can't even take joy in the yabba dabba doo. How does the moon roar his no mouth? Hilarious. Jesus. Star Raptor got fucked. He was gonna get fucked again. No, I got fucked. Have a luck, buddy. It's all up to you. Now that's a conkeldurr I can get behind. Now this is a fucking good conkeldurr. I'm gonna fucking hold on to that, actually. Whoops, I don't want the background, I wanted the conkeldurr. Oh well, I'll get him somewhere else. Oh, and you're a fighting. We're great. Love disc. Maybe. Damn it! Wasn't for that stupid guts boost. And there we go. Oh my goodness gracious. Well. One minute. 1 minute. 1 minute. You know what the music means. I think we got a lot done today, you know, personally. What did we learn? We learned that Needle doesn't have a career waiting for her in the medical field, which is important information. And we also know that Needle doesn't have a career waiting for her in the, you know, full-time Pokemon VGC winner field. I think I already knew both of these pieces of information. But that's gonna do it for me. I hope everybody enjoyed the stream. I'm sorry, you know, my apologies for ending so quick after the raid, but I was, you know, it's getting a little bit late. You did enjoy it, I'm so happy. I'm so thrilled that you enjoyed it. And even though I said that like I was sarcastic, I mean it genuinely. Let's see, who is around to raid? Let's raid Flower. Oh, she has a cute GIF on her screen. I loved it. I want to put that GIF on my starting soon screen. I don't even know if anybody's still around to fucking do the charade, but whatever. You're here? You know, that's what's most important. You know, if one person's here, that's good enough for me. You know what? Even just one person is good for Needle. So I hope, though, oh my god, you 2 people? That's twice as many! Moron dummy. Oh, good, and you're mean to me. Even better. I will see everybody on Sunday. I might squeeze an extra stream in on Saturday, depending on what I got going on. Depending if there's something I think would be really fun to do. But the good way to find out that information is you can follow the Needle Twitter or join the Needle Discord, with the links available in helpfully above. There's also my Needle VOD channel, which I've been slacking on uploading to again, but I'll get to it. Anyway, I hope everybody had a good night, and I'll see you soon. So long, everybody. Farewell.